Right now he's running as, we call him Standard Man or Standard Man. So we're getting base physiology right now. He's breathing, he's blinking, and now he's sort of up and running. He runs off of a motor, if you will, or a compressor. Whereas inside of here we can see the lungs expand and the chest moves up and down. You have his battery pack, okay? And here is his circuit board. And essentially it's a router that connects to our computer as a workstation. So he is sort of a wireless router in and of himself. The great thing about the Meti-Man is his ability to provide us with real-time physiology. We're going to be able to take a real-time blood pressure where you're going to get it reading just like you would on an actual real person.
We were actually learning about the eyes not too long ago, and we've learned about subdural and epidural hematomas and how the pupils react to a blown pupil.
Light comes in, we get a constriction of the pupil, take the light away and it bounces back. Both eyes, for this individual right now, he's uninjured and is relatively normal. Both are going to react accordingly. They will be able to notice his tongue swelling in certain situations. In concert with an EMT, with that tongue swelling, they may be able to perform a tracheotomy on the Meti-Man. So this is the area where the tracheotomy would occur, and then be able to insert the tracheotomy tube. We can perform real-time chest compressions in a situation where we're needing to do CPR and actually see the results of that on an EKG as you would with a real patient.
It's basically just a bionic man in a way who can share the same symptoms as what we'd see in the real life.
He can mimic things that we really can't mimic with each other. You know, if the students want to model different, they can model different things in lab. Hey, I've got a head injury, but they can't mimic the pupil reaction. They can't mimic the decreased pathology. They can't mimic the physiology. We can with the Meti-Man. We can set him up to have that head injury. We can set him up to have a neck injury, to where there could be some catastrophic consequences if not treated correctly. The nice thing is the student can learn on the Meti-Man, and we know if we do something wrong, he is a simulator. Now, it's going to be used beyond athletic training. We can look at the physiology and simply just throw that up in an exercise physiology class, look and see how the body reacts to different stimuli. Our plan also is to run some weekend seminars or some workshops with local athletic trainers, with EMTs, talk about what it is that each group does and how we hand that patient off, and use a simulator as part of that. So those possibilities are somewhat limitless.